the two presentations, one will be on just the status of balneology in North America. I know we've gotten to hear a little bit about balneotherapy and how it's being used in therapeutically. So today is just going to be an overview of the field of balneology in North America, and then I will give a quick case presentation from my practice on some adjunctive physiotherapy that can be used in outpatient settings, as well as in thermal health centers, etc. So American Balneology. I'm, again, representative of the Balneology Association of North America. I direct our water medicine program through that organization, but I'm also in private practice as a naturopathic physician, which perhaps maybe we're not so familiar with. Naturopathic is in the United States, most of the states license us as primary care physicians. So we are a primary point of care for our patient population. Naturo is, of course, from the Latin natura, which is oftentimes thought of as natural, but really it is a translation of the Greek physis. So naturopathic is an approach to primary care that studies the health and disease of the body from physical expression. And our therapeutics are selected accordingly. I love being part of these types of presentations because we get to really go in depth with a lot of the physical processes. I mean, just learning today about calcium in mitochondria and treatments with N-acetylcysteine and everything really help to refine the therapeutics that we use in clinical practice. But this is my role with balneology, is to help incorporate more of these physical therapeutics that are being utilized in the United States. And so balneology has a rich history in the United States, first known to the Native Americans. Some common features that we see from that time period is that the waters that were known about were known to be healing waters. They were always considered to be located on neutral ground, so that different tribes that may utilize them, they would never war on those. That property belonged to everyone. It was not a particular group's property. The water was seen as sacred medicine, and those water sources were places of peace. There's always stories of everyone putting their weapons down in order to engage in the healing. That fast forward to the founding of the United States. Hot Springs, Arkansas is the first land purchase by the United States. It's the first federal land purchase, and the water was used at the time by Revolutionary War soldiers to help win convalescence from battle. This is a picture of one of the bathhouses in Hot Springs, Arkansas. At the time, from the founding of the United States up until about the 1940s, balneology had a rich practice across the United States. This is a bathhouse in South Dakota. This is actually President Roosevelt soaking in the waters at Hot Spring, Arkansas. Of course, I think we're all familiar with, what a balneology treatment room might look like. So very robustly used. It was considered kind of resort style medicine was considered a mainstay of medical care. And it even enjoyed, scientific research and, standardization across the field. And these are two examples of early publications around the turn of the 20th century, looking at the different waters, how they're being used, and et cetera. I bring this up only to say because from about the 1920s to the 1940s, there was a decline in the use of balneology in North America, which was largely due to two factors. One, this report by Abraham Flexner, it's called the Flexner Report on Medical Education in the United States and Canada, which was produced by the Carnegie Foundation to standardize medical education in the United States, and basically established the Johns Hopkins model as kind of the standard of medical care. However, what happened is practices that were not based in patent medicine tended to not be inclusive of this model and fell by the wayside. Add to that the the discovery and widespread use of penicillin by Dr. Alexander Fleming, and we start to see a medical climate that is leaning more towards drug intervention. So physical therapies in the United States tended to be seen more as archaic and fell by the wayside, which meant that these rich bathhouses across the United States fell into dereliction. And so this is a few of these different once popular thermal healing centers that are now abandoned across the United States.
Marcus, if you like to present your case report, maybe it is better that you jump
Sure.
to the end of history and you start with the case report.
You got it. You got it. I'll just breeze through this. Most of
Wonderful pictures.
Thank you. Yeah, it's beautiful. Most of the springs today are used in natural setting, family recreation, or in a wellness prevention setting. My group is working with a couple of other organizations in the United States to reclassify natural mineral waters as therapeutic agents so that we can establish a basis for research in the United States, which is largely absent at the moment. We're working with international partners to help establish that essential nature of balneology so that we can get proper research and start to provide the level of information that we see at an event like this. And I believe in the post-COVID time, balneology has a particular role to play in convalescence from the chemical strain of the virus on people's bodies. And you can see a whole group of symptoms that are associated with the post-COVID syndrome that are treated well in the balneologic thermal healing center setting. Our group supports training for medical professionals, research and information dissemination, cultural awareness, legislative efforts, and international cooperation. And you can find us at balneology.org. That's our group here. Thank you for this. And I will just move very quickly here if I can. 1 second. Okay. So what I will be presenting here is this is a case report from my private practice. I do not practice at a balneology center, but I practice in a way that has a primary focus of interventionary physiotherapy. So I want to present a case today of how we use physiotherapy in a broader context. So today I'm going to be talking about the use of low volt galvanic current and ionophoresis with supplemental physiotherapy in the treatment of a recalcitrant diabetic ulcer with osteonecrosis of the foot. The patient is a 78-year-old female. She's a retired pediatrician. She presented to the clinic with a 2-year history of a non-healing foot ulcer. Her initial workup included a comprehensive physical exam, a records review. We started her on a dietetic program to help control the diabetes that was at play there, and a prescription of herbal and nutrient-based medication was prescribed. Just a quick anatomy review because I'm going to be showing some pictures of this foot. They're medical pictures, so just be aware of that. We're going to be looking at a couple things here. This tendon, the flexor hallucis longus tendon, is going to become an important tendon because this patient had it surgically cut in order to remove strain on the bottom of her foot. And then I also want to note the transverse tendon and the heads of the second and third metatarsal. Those will be very apparent in the pictures that we're about to see. Let's see. So she had the initial ulcer had been 2 years previously diagnosed as a structural abnormality. Her flexor hallucis tendon was cut to relieve the pressure during ambulation. But the ulcers persisted, and at that point, no one had run a hemoglobin A1C or anything on this woman, unfortunately. And so this surgery happened before there was realized that the ulcers was not structural, but in fact due to an unchecked diabetes. So the patient at the time that patient presented to the clinic, she had been worked up by an orthopedic surgeon who was recommending amputation of the foot. She absolutely refused amputation and was refusing medical care in general. And she came by us reluctantly through her son who dragged her into our office. So our goal was to control her diabetes through the use of natural, herbal, and homeopathic medicines and diet, alongside enhanced tissue regeneration using the naturopathic physiotherapy method, which again, just from watching some of the talks today, I have an even more refined idea of what's happening with this. And I hope that'll be apparent to everybody as I go through. So I'm going to start showing some photos here. This was the ulceration at the initial presentation. You can see that over on the right-hand side of the screen, that's her first digit of her toe, and it's retracted because of the cut of that tendon. This calloused area is the primary point where she makes contact, and you can see it's heavily calloused, and then we have this ulcerative area that's draining. So we start her, in addition to the regimen I described, we start her with warming torso wraps to improve blood circulation, oxygenation, and lymph movement. That has a similar effect as a balneotherapy bath, but can be applied in an outpatient setting. It's not as effective, but it works in our case. And we accompany that with a low volt alternating current, like basically a muscle stimulator, but we apply it at subcontraction levels to help. We apply it to spinal reflexes to help improve her digestion and blood sugar control. And we also run it through the affected limb to help improve microcirculation, lymph drainage, and as I learned today, mitochondrial improvement of the muscle tissue in that area. So this was her foot on about a month after her initial workup when she started coming in regularly for treatment. This is following week, September 21st. She would come in twice a week. This was a case I saw this past year. October 2nd, you can see that wound is starting to close up and callus over. October 9th, October 16th, and October 30th. Now you can see that calloused area on the medial aspect or central aspect of her foot is starting to show this kind of bruising effect, which as soon as this area closed, it became apparent that there was something bigger going on underneath this area. I should mention at this point that this patient absolutely refused to do any type of medical workup in terms of MRI because she was just so fearful that everything was going to lead to amputation. So pushing her to get imaging done. In the meantime, I'm treating, just empirically on what we're seeing here. And this is November 20th. That initial ulcer totally closed up, but as you can see, we have a growth on that underneath that callus there. On January 2nd, everything opened up, and you can see that we have this. It's about a centimeter. It's about 2.5 inches by 1.5 inch ulceration in the center of the foot that was underneath that callus the entire time. When that fistula into that initial callus closed, it created fluid buildup, and eventually everything ruptured. It was sanitized and debrided, and then finally convinced her that it was a good idea to get that MRI, which she did. So again, remember what we're seeing here. The bones and the ligamental structures that were destroyed due to surgery, but also a subsequent physical trauma from her walking around on this ulcer for 2 years. Her MRI saw likely osteomyelitis along the second and third metatarsals with destruction of the bone, probable cellulitis, and a likely abscess along the third metatarsal. So at this point, I need to change the physiotherapy program that we use in order to directly treat what we're able to visualize, as well as now have imaging to support. So the physiotherapy tactics shifted to using iontophoresis with a silver positive galvanically driven into the tissue, which has an antimicrobial effect to treat the osteomyelitis as well as the abscess, and adjunctively with a pulsed shortwave diathermy. I'm going to talk a little bit about those and how we utilize those to good effect in wound healing. Galvanic ionophoresis. Galvanic current is a polarized current. It has a positive and negative polarity that you apply through tissue. Those polarities. Pardon me?
Non c'hai l'audio. 2 minutes left.
Oh,
Thank
of course,
you.
yes. So using the positive field of the galvanic current, we're able to drive that silver into the tissue, and we use pulsed shortwave diathermy to improve local circulation as well as metabolite transfer across the tissue to improve wound healing. And then we, with kind of standard of care autolytic desiccation, use medical honey, a silver dressing, and a hydrogel covering to maintain antiseptic state of the wound. This is January 14th, January 18th, 19th and 21st. You can see the wound is approximating, has nice granulation tissue, and you can see the metatarsal head is exposed, and you can even visualize the necrosis. January 25th, 28th. Now we're into February, continuing to heal nicely. You can see here on February 8th, the head of the second metatarsal actually expelled itself. This necrotic piece of bone actually totally detached and came out just on the treatment table without any intervention. February 11th, 18th, end of February into March, March into mid-March, end of March, and April 5th. And so this is the last photo I have for today. You can see this initial ulcer is almost completely closed. There's a little area here where the primary ulcer was that eventually opened back up. And we continue to treat this patient bi-monthly to support circulation and wound closure as we continue to stabilize her diabetes. Her current hemoglobin A1C is 5.8.
Many thanks for your
thank you.
case report. We invite you to stay with us, because now we will try to discuss our future plans of two research group, and maybe if you will be interested, you may join at least one of the two.
Thank you.
You stay with us.
I'll stay on. Thank you so much.